Fact. So tuberculosis is an infectious disease that can affect any part of our body, whether it is starting from the eyes, skin, nose, throat, glands in the neck, lungs. Of course, lungs are the predominant site. But apart from that, abdomen, intestines, lymph nodes in the abdomen, the genitourinary tract, bones, literally every organ of the body can be affected with tuberculosis except for hair and nails. It's an infectious disease which is spread from one person to the other usually. It has a very long incubation period, meaning the bacteria after getting exposed to you, after you have got exposed to the bacteria can reside in your body for years to come. That is what is called the latent tuberculosis. And then a day comes when your immunity is low or your exposure to the bacteria is overwhelming. That is when the disease starts to manifest in symptoms. Tuberculosis is one disease that I feel nobody should be afraid of or apprehensive about or carried as a stigma. It is like any other infection that you could have acquired. Tuberculosis is a more common infection than any other infection, in fact, especially in our country, in our kind of setup. What is important to eradicate tuberculosis from your body is to take your treatment regularly. All it entails is taking 4 drugs, that is rifampicin, INH, pyrazinamide, ethambutol, all of them preferably together, preferably before breakfast every day. You take that dose once in the morning every day and you're done for the rest of the day. You can continue with your normal living. I strongly believe that if you take the treatment properly, complete the course, there's no reason why this disease shall recur ever in life again, unless you have another exposure anytime in future. Of course, no disease is good to have, but amongst the various diseases, I feel tuberculosis is one of those diseases which has a standard treatment regime, which is followed across the globe. Every country, every nation, it's the same treatment wherever you go. So there's no chance of ever getting confused with the medication. The WHO regimes, the Indian government recommendations regimes, they're all very standardized, protocolized, that we must follow and get the disease eliminated from our country.